Hello, my name is Carl Cooper, and I'm the Project Manager for the National Disability Navigator Resource Collaborative at the American Association on Health and Disability. And this is our presentation, Health Insurance Jeopardy, Part 2, Medical Devices. For those of you unfamiliar with the National Disability Navigator Resource Collaborative, or NDNRC, it's the mission of the NDNRC to provide cross-disability information and support to navigators and other enrollment specialists, thereby ensuring people with disabilities receive accurate information when selecting and enrolling in insurance through the Affordable Care Act marketplaces. And I always say that when a consumer is looking at plans on the ACA marketplace, it is like playing a game of health insurance Jeopardy. I say that because those of you familiar with the game show know that in Jeopardy, it's not about the answer, it's about asking the right question. And consumers need to make sure they are asking the right questions about the plans being offered in order to make an informed choice. So let's play our game. Today we're going to be looking at the category medical devices. Let's start off with a situation where the individual is a wheelchair user. In this instance, you need to ask the question whether the Qualified Health Plan, or QHP, covers durable medical equipment, or DME. And for one of the essential health benefits under the Affordable Care Act that all plans are required to cover is medical devices. But medical devices has not been defined yet, so it means different things for different plans. And you need to find out, therefore, if durable medical equipment is covered under this person's plan. And if the same individual uses a motorized wheelchair and she complains that her current chair won't keep a charge, then you need to ask the question, does the QHP recover the repair of the DME? Not just the purchase of it, but also the maintenance of it as well. Because sometimes insurance companies deal with both of those differently, and you need to make sure that it's going to cover everything if the individual is going to need it. Next, if you have an individual that indicates that his condition requires he use a catheter, this goes to another issue of whether the QHP covers disposable medical supplies. And medical supplies are different than medical equipment, and even though they're all under this broad category of medical devices, once again, since medical devices has not been a defined term, it means different things in different states, and in different, even in some states, from plan to plan. So you need to be making sure that you're finding out exactly what is covered for those situations, and obviously then what the copays are related to them. If the individual is an amputee, then you need to ask the question, does the QHP cover prosthetics? And in this same situation, you also need to ask the question whether the QHP puts a limitation on the number of prosthetics. Limitations on the number of prosthetics can happen in different ways. It can be on the number of prosthetics that the person can get, or it can be on whether or not repair and replacement is included as well. So those are all things you're going to want to make sure that you're looking at when you're considering a plan that the individual might be looking at, if that's going to be something that they're going to need. If you're interested in finding out more about the NDNRC, you can check out our website at www.nationaldisabilitynavigator.org. You can also find my contact information on this slide. Feel free to reach out to us if you have questions as you're assisting an individual with a disability enroll in health insurance. Also, please subscribe to our YouTube channel to get more helpful videos like this one. And if you're interested in learning about the other categories that were listed, be sure to check out the links in the description below to access those videos. Thank you.